Okay, so the second ethical station is a slip of paper, and this is the scenario. Discuss the ethics of treatment resources being used on patients who knowingly ignore public health advice on smoking and exercise. When answering this question, obviously the first thing that's come to mind are autonomy. So patients have a right to live their lives how they like, and that should not affect their receipt of healthcare in the context of the NHS or in the context of medical ethics in general. The conflicting part of this is potentially justice. So when we have limited resources in a healthcare system and we have to make choices about who does and doesn't receive healthcare, then potentially healthcare choices and lifestyle choices can be used in making that decision. So we'll just go into an example answer. So the question here outlines a conflict between two of the pillars of medical ethics. So firstly, we have autonomy, which is the ability for patients to make decisions around their own healthcare. So the question relates to smoking and exercise, and NHS resources on the principle of autonomy should not be held back from patients that make poor lifestyle choices, as it is their own right to make decisions around their healthcare. And if they choose to smoke excessively or to not exercise at all to reduce their overall health, then that is their decision, and that is what the principle of autonomy would uphold. However, the conflicting side of this is justice. So in a healthcare system where we have limited resources, we need to make sure that we are sharing those resources fairly and evenly amongst the population, and potentially taking into account decisions and lifestyle choices that patients have made isn't the most unfair way of deciding where we allocate healthcare resources. The only context of patients' lifestyle choices actually affecting the resources that they receive in the NHS or in a healthcare system that I'm aware of are liver transplants for patients who are still drinking. So with a limited number of livers to transplant, patients who are still consuming alcohol and still negatively impacting the health of their liver are on a lower priority or are not eligible to receive a liver transplant. So to receive a liver transplant, you need to be absent from alcohol for a good number of months, sometimes longer, before you are eligible to receive a liver transplant. But outside of that context, I don't think that autonomy, or I don't think that patients' lifestyle choices should be affecting their ability to receive healthcare. I think that autonomy is a very important principle within medical ethics, and it shouldn't be compromised, even despite a situation where you have limited resources.